who are diagnosed with BPH, which stands for benign prostatic hyperplasia, in other words, also called enlarged prostate. And these men come and see me for generally an hour visit. Sometimes they bring their spouses, sometimes they don't. This gentleman had had his symptoms for quite some time, about 5 years. And he was referred to me to learn about his condition and learn about treatment options for shared decision making. Around about 45 minutes into the hour visit, he paused, stopped, and looked at me, and he looked at his wife and said, "You know what, I've never told anybody this, but I gave up my Gopher tickets." And what he meant by that was that he is a University of Minnesota avid Gopher basketball fan, and he had given up his season tickets because he was not able to sit through a game without having to get up and go to the bathroom constantly. But after this meeting with and learning about his condition, he realized that there were treatment options and that he could live with this condition depending on what kind of decision he was going to make. So it was a revelation for him, and he was really much happier, and he was going to go buy next year's season tickets as soon as he could. That I have meet with, and we were talking about, again, the same condition, BPH, but he was wanting to know, how is it that my primary care doctor, how does he diagnose that? And he had attended a special session with one of our specialty doctors called a urologist, and he had heard about how BPH is diagnosed. He asked me, "So tell me, what do you have to be a specialist to do a digital rectal exam?" A digital rectal exam is one of the diagnosing things that our physicians do to diagnose it. And what he meant by that was that he thought that digital was referring to technology and not the digits of the hand. And that is an example of patients sometimes not understanding the most simple things that are talked about in the exam room. But when I talk about their condition, I try to keep it in lay terms. I try to explain to them what things mean, and this was a revelation for him as well, that you don't have to, your primary care doctor does a digital rectal exam, and it's not the technology that allows him to do that, but it was just the simple fingers that do the exam. So it's really about health literacy, which is also part of shared decision making and informing the patient. What I love about my job is that I have the ability to help them understand and most often things that they have a really good understanding of. And so specifically this condition with men. But I have an opportunity to interact with them, I have an opportunity to give them information, but also to help them make a decision that they now have more information on that they may not have ever gotten before, and they have a way of looking at other tools, not just reading text, but also looking at a DVD. Oftentimes I ask them about, how do you learn new things? And many of them say through visual means. So the DVD is an excellent way, and I think that we use that together. We look at the clips of the DVD together, and I highlight some of the information. So it's a really interactive visit, and I get good feedback because most of the time they leave the visit with something that they didn't know about before they came. Very rewarding. For those physicians who have been resistant at first, what has really helped them to embrace this is to hear from their patients. The patients coming back to them saying, "This was a great experience, I learned something I didn't know before, I was able to make a decision and it affected my lifestyle, and it was a personal issue for me and it was based on good information. When they hear that from a patient, that's probably the most powerful thing that's available. And I think that helps them to have a better buy-in.